Hi, ladies and gentlemen, it's Dr. Hu Navoa. So I had promised that I would go and give examples of these issues with any particular biological implant. And today's subject has to do with the placement of a vaginal mesh or a laparoscopic mesh in the rectal area and the complications associated with that. Now, it's important to understand that the complications associated with the placement of meshes are exceptionally high. It's not unheard of to have a percentage of approximately 9%, and there's apparently even a higher complication rate associated with the placements of meshes as a laparoscopic approach. Again, the informed consent issue is so important to understand that not only could you have the more obscure but definitely present autoimmune issues that you can have with meshes, but we're also talking about what is one of the most complicated and the most dramatic or catastrophic complication associated with the placement of meshes, and that's going to be the erosion of the mesh through natural tissue into surrounding tissue. In this particular example of this posted case is the erosion of the mesh into the intestinal tissue, causing catastrophic issues of multiple surgeries. But more importantly, you have to understand that this is not an uncommon complication. If your GYN doctor, if your colon rectal surgeon doctor, if your general surgeon doctor is telling you that a mesh is not associated with serious complications, they're basically not telling you the truth. Okay, they're gaslighting you, like I said before, medical gaslighting you. All right, not only is this foreign body effect catastrophic in some cases, causing infection, causing chronic pain, but causing erosion of that mesh into surrounding tissue, which if it happens to go into the intestine, you're going to have to get a bowel resection associated with that mesh. So I understand that the same thing applies to hernia meshes, abdominal hernia, ventral hernia meshes, where they erode through the skin on the anterior portion. So they erode through the tissue, the skin where you can see it, but they also erode in deeper into the intestinal tissue, causing a whole bunch of scarring. And if it erodes into the intestines, you're going to have a bowel resection, sometimes a permanent colostomy, or in some cases a shortened bowel, so much so that you can't even eat normally anymore. Can you even imagine that type of complication? Well, many patients don't have to imagine it because it's actually happened to them. So please keep an open mind, but at the same time, please remember that if your doctor is telling you there's not a lot of complications related to mesh biological implants, they're gaslighting you. Thanks so much for watching. Please read the article attached to this post. Thanks so much for watching. Take care.